Good afternoon. It's Monday, the 9th of January 2023, just after 1 o'clock. Welcome to UK Column News. Your host today, Mike Robinson, myself, Brian Gerrish. We're delighted to be joined by David Scott, bringing us northern exposure from north of the border, and Mark Anderson reporting from the United States.
We'll get straight on with beds in the NHS, and £250 million for beds. Where are they going to go? Well, they're going into care homes, perhaps, but other settings. And so the question, Brian, is what are other settings? Other settings, according to the mainstream press, seem to be hotels. So hotels now not only being used for immigrants coming into the country, but also for people coming out of hospital. So this is Plymouth Live from the end of last week. Derford Hospital patients put up in Plymouth's Leonardo Hotel in bid to ease bed blocking. In fact, this isn't the first time this has happened. So that's from the 6th of January 2023. Here's December 2021. Plymouth Hotel transferred into care facility in bid to relieve NHS. And in 2020, prominent hotels set to house Derford patients. This seems to have been the situation pretty much since COVID, that any hospital overflow would end up in hotels. Of course, there's no social care system left in the country, Brian. But let's just remind ourselves the graph that I showed last week from Statista, basically making the point that the decimation is more than decimation of beds in the NHS over the last 20 years. A global policy, not a party political policy, but something that both of the major political parties have implemented in their time in government. So here's what Steve Barclay had to say about this, or is going to be saying about this, because he's going to be making a report to Parliament today. In addition, we're trialling 6 national discharge frontrunners, innovative quick solutions which could reduce discharge delays, moving patients from hospital to home more quickly. Now we'll come on to the hospital to home bit first, but just if we just leave that up on screen for a second, I just wanted to mention some of these 6 national discharge frontrunners. For example, Sussex Health and Care Integrated Care System are trialling a new data tool to help services manage performance, give operational oversight and manage demand. So that's going to help. Humber and North Yorkshire Integrated Care System are going to be supporting patients to move across health and social care organisations through innovative use of data and real-time intelligence. And One Croydon Alliance are going to be trialling a fully integrated team between acute and community, integrated IT system, integrated financial systems and integrated leadership to better coordinate between hospitals and community care settings like rehabilitation systems. So that's all good stuff. It's all clinical. It's all going to make sure that people are well looked after when they leave hospital. But just moving back to the moving patients from hospital to home more quickly, let's just remind ourselves about the latest all-cause mortality statistics, which takes us up to the 23rd of December, and you can see that massive spike in the 23rd of December. We've got to remember that, 37% of those, the largest proportion of those excess deaths are in the home. And so perhaps that tells us why they're wanting to move people out of hospital back into home as quickly as possible, Brian.
It's, I don't know what to say, Mike, actually, as we watch this unfold. Is there a war on this country? Well, there isn't technically at the moment, and we're just seeing the NHS ripped to pieces. But at the moment, there's no public backlash. I wonder how long it's going to take before the public realise that this destruction of the NHS is orchestrated from the inside. And what's happening in the wider care system? Well, there's a court case reported today where an elderly lady was put on end of care pathway. Her family were not told at the time, so she died. She was effectively, she was put on end of care and died. Family not told. So now the authorities, which say they're there to help, have the powers to decide whether you're going to live or die. And remember that the NHS has now declared that it's going to be getting into nursing homes and care homes in order to diagnose people with dementia. And if you've got dementia, presumably you can be put on an end of care pathway. So this is a massive attack on the public of the UK, but it appears that many people still haven't woken up.
Well, let's look at another massive attack.